When I got pregnant, it was just, I didn't know any other options other than just going to the hospital. So we started going to an OB, and it was just less than exciting. Going to our visits were, 15 minutes with a different provider every time, and especially our first visit where we were really excited. We're these first-time parents, and then we went, and I mean, they weren't excited for us. It's like, okay, next. And
women need to realize that they are, in some ways, consumers of the medical care that they ask for, and start asking for something different. So start asking to be respected and spend more time with that caregiver. Start asking to be understood, and start asking to be respected when you have questions about what's going on. Because if you don't ask, then you're going to go right into that system and do exactly what they want you to do, and that's not always what is best for you or what's going to give you that satisfaction or that experience.
I felt like I had to make sure I was doing my homework with the midwife to ask, a ton of questions about, well, what happens if this happens during birth, and what happens, so I asked a ton of questions that, what happens if the cord is wrapped around the baby's neck, and because I've heard a couple friends who the baby came out that way, or if the baby's breech, or if the baby's this or that, and I wanted to make sure that we weren't adding a level of additional risk.
Had you asked me years ago if I would have done this before having educated myself and spoken to other women who had done it, I wouldn't have, just out of fear. But after educating myself and knowing all my options, the choice was so much easier. And what I do want to tell women is there is risks in any choice. There's risks in getting pregnant. There's risks in giving birth. That's never going away. But there's also risks with having interventions and having procedures and having a labor-induced unless it's absolutely necessary. They lead to more complications. So the main thing I would want women to know is that just because medicine does it doesn't mean it's safe and there is no risk.
It started with the data of what happens in a hospital and how there's so much unnecessary C-section, and then it flowed into understanding sort of how much more comforting and enjoyable it could be to not have a birth at home. So this combination of those two things that really was like, wow, this makes sense both from a heart and a head standpoint.
The choice aspect or the option aspect is much more possible when you're in an environment where everyone around you understands that you're the one giving birth and you don't need assistance. They will step in if something goes wrong. And the midwives in our country and across the world have the skills, training, and experience to know when they need to step in, either at home or take that person and transfer to the hospital.
My mind and my background is in ecology and science and everything, so in my world it's a lot of statistics. So I just did basically everything I could to increase my probability for success at the end. There's no guarantees in everything, but I was just trying to up the ante every step along the way. And for me, building that trust relationship with my midwife really helped out, because with my labor, it was a little long, and she honestly had the right to say, no, you should go to the hospital, and this is just taking too long, and we can leave it up to modern medicine to try to push you along the way. And she offered me that option a couple of times, and I asked her, please, stay with me because I can do this. And because I'd worked with her so much and building that trust relationship, I think that's what led her to say, fine, I'll stay here, I'll be with you.
I reviewed the world literature for 30 years, and if you want a safe birth for the mother and baby, the safest birth attendants worldwide are midwives. And go look it up. Don't believe me. Go look it up. Look up the research.